Let's look at a classification system for benign prostatic hypertrophy on MR imaging. We've got three two-dimensional fast spin echo images of the prostate: axial, sagittal, and coronal. So let's begin with the Lobar classification system for BPH. Type 1. The enlargement is predominantly anterior and pushes the urethra towards the back. There is some anterior hypertrophy in this case. Type 2. There'd be a solitary area of retrourethral, there's the urethra, retrourethral enlargement, but above the virumentatum. And we do have that. If we had that and it was isolated, it would be a type 2. What's a type 3? Type 3 is when you have both and they're balanced. This one is a type 3. It's balanced. Both the anterior gland, maybe a little imbalanced, and the posterior superior gland are enlarged above the virumentatum. So I would say this one's a little bigger. It's slightly imbalanced towards the back than the front. What's a type 4? Prominence of the median lobe, the periurethral tissues, which may push the central zone up, but also invaginate and encroach on the urethra as a pedunculated mass. This one is actually the least common and hardest to see because everything gets crowded around the urethra, and it's hard to know whether you're seeing an intramural lesion that's pushing in or a pedunculated lesion with a stalk that's pushing in. So that one, to designate in an isolated fashion as a type 4, requires very high resolution, 1 millimeter or thinner MRI. So those are the 4 Lobar classifications which you can use and extrapolate onto the MR image. This an example of a pretty balanced hypertrophy, a little more in the back than the front, a type 3 pattern of Lobar BPH.